Welcome to the Orthotool Orthokeratology Custom Design Lens System. In this section of the certification, you will learn to use the unique design methodology behind Orthotool custom lenses and begin optimizing your orthokeratology treatment for success. Each Orthotool lens is custom designed for the unique patient wearing it. Our philosophy is simple. We give the practitioners complete control in designing a lens specifically catered to the patient's needs. Provided with a patient's age, refraction, corneal topography, and visual needs, the Orthotool system allows for a high degree of customization across multiple zones in the contact lens. Designs can vary from simple, allowing the fitting software to take control and select the initial parameters, to complex, allowing the practitioner to control every lens curve. With the Orthotool design system, a full range of custom rigid gas permeable lenses can be created with a wide range of lens building options. In basic mode, you can provide patient RX and topography and allow the Orthotool software calculator to create a lens design based on an optimal tier layer diagram fitted to the corneal topographic data. Alternatively, you can take the initial calculated parameters and custom tailor each parameter based on the patient's visual needs, such as optic zone size or centration-focused alignment curves. Alternative designs can be created as well, such as single vision and multifocal lenses. Integrated within the Orthotool online platform is an automated order form that automatically sends your lens design directly to the Orthotool partner lab of your choice for fast and easy ordering. Orthotool is a 5-zone orthokeratology lens construct, each of which can be customized as required. Customization of these zones are intended to optimize myopia treatment, centration, and comfort of lens wear. It is available in rotationally symmetric and toric variants. Using a ruler or topographic image, measure the patient's HVID. Then choose a diameter approximately 0.4 millimeters smaller, or 0.2 millimeters on each side of the lens. The reason we do this is to provide the largest allowable overall diameter to contain all necessary curves. This allows the alignment curve to cover as much area as possible for effective centering force. This will be discussed later. Notice there are multiple ways to conveniently modify the diameter of the lens, from the shortcut buttons on the graph to manually entering in the value on the lens RX section. The back optic zone diameter is the innermost zone of the Orthotool lens. This curve reflects the amount of myopia needed to be treated. The compressive forces required to mold the corneal shape for treatment is determined by the base curve radius. This zone will be automatically calculated by the Orthotool software. The practitioner can then further refine the necessary treatment by flattening or steepening the initial value calculated by the software. A flatter base curve radius, which is higher value in millimeters, will create a greater myopic treatment effect, whereas a steeper base curve radius, or lower value in millimeters, will create less myopic treatment. A unique feature of the Orthotool software is its ability to further control the degree of myopia treatment effect, often reflected in the peak tear layer thickness, or TLT. However, low myopes in spherical back optic zone designs, where E equals 0, cannot produce a significantly high TLT for their myopic treatment. By progressively increasing asphericity in 0.1 increments, from 0 up to 2, one can choose the appropriate aspheric base curve that will result in the best patient outcome, regardless of prescription. An additional level of control within the back optic zone is the diameter of this zone. Adults require larger back optic zones such that the treatment zone can be maximized and pushed beyond the pupillary margin. This will help improve clarity, especially during nighttime activity, by removing unwanted aberrations. Conversely, Children with smaller base curve zones will result in greater peripheral plus power and positive spherical aberration entering their pupillary margin, relevant to their myopic treatment effect. This additional layer of control is beneficial, especially in optimizing treatment across a wider range of RXs. The apical clearance refers to the tear layer thickness, or TLT, at the apex of the cornea. The clearance in this area is critical in generating the fluid forces underneath the lens that controls the corneal molding during treatment. Moreover, either insufficient or excessive apical clearance will result in an unstable lens, causing the lens to decenter or corneal staining. Zero or insufficient apical clearance will result in poor molding and therefore treatment effect, and possibly superior decentration of the lens. Excessive clearance will result in inappropriate molding and inferior decentration. Apical clearance can be controlled either directly by inputting the value in lens parameters or adjusting the reverse curve or alignment curves. The second zone in the Orthotool lens is the reverse curve. The reverse curve not only connects the base curve and the alignment curve, but controls the entire sagittal depth of the lens. That is, changing the reverse curve radius can make the overall lens flatter or steeper. The practitioner can first enter in a desired or preset apical clearance value, for example 5 microns. The Orthotool software will then automatically calculate the appropriate reverse curve radius required to give the desired apical clearance. As with all other parameters in Orthotool, fine-tuning of this curve is possible by manually making the reverse curve steeper or flatter. Making the reverse curve steeper, which is a decrease in value by 0.1 millimeters, will steepen the fit of the lens by 5 microns. Making the reverse curve flatter, or an increase in value by 0.1 millimeters, will flatten the fit by 5 microns. The Orthotool lens adds a curve that connects the reverse zone to the alignment zone. The reverse zone has typically the steepest curve in the lens, whereas the alignment zone is usually flatter. The relief curve allows the practitioner to customize this transition, making the transition between the two more aggressive or more gradual. The alignment curve, or AC, is part of the Orthotool lens that lands and stabilizes itself on the corneal surface. As such, this curve is critical in ensuring a well-centered contact lens. To maximize stability and flexibility, the alignment curves are divided into two separate curves, AC1 and AC2, which together take up at least 30% of the total diameter of the lens. The larger alignment zone ensures greater surface area contact and therefore stability. Orthotool software calculates an initial alignment curve based on the corneal eccentricity of the patient. From here, practitioners can manually adjust AC1 and AC2 to further optimize comfort and centration. As the alignment zone is where the contact lens must land on the cornea, it is critical that the alignment area contacts the cornea and there is minimal tear layer beneath the zone. Reasons for excessive tear layer under the alignment zone would be an excessively steep AC1, radius too low in value, or the alignment zone is excessively flat, where AC2 radius is too high in value. Manually adjusting the AC1 and AC2 curves while monitoring the tear film diagram will allow the practitioner to find the perfect radius that will allow the alignment zone to optimally rest on the cornea. Start by adding a patient and entering in their data. When creating a new design, you can either start from scratch or select from a template with pre-designed lens parameters. After setting the overall diameter and optic zone diameters under Preferences, enter in the patient RX information. Orthotool's software algorithm will automatically calculate the ideal contact lens design, optimizing a myopia treatment tear film diagram. Fine adjustments can now be made, such as adjusting the Jessen factor, diameter, and optic zone diameter. When ready, use the automated order form to send your lens design directly to the Orthotool partner lab of your choice. You can also switch from basic to advanced mode, where you can adjust a wider range of lens parameters, such as lens eccentricity, apical TLT, and much more, all aimed at maximizing myopia treatment and lens fit for your unique patient eye. When creating a new design, you can either start from scratch or select from a template within pre-designed lens parameters. In this way, you can quickly start from lens parameters targeting specific patient populations, such as adults versus children, or high versus low myopes, etc. Dispensing Day 1. In the initial evaluation on eye, inspect and clean the lenses before placing on eye. Fill the lens bowl with 1 drop of saline and fluorescein. Insert the lens with patient in head-down position to ensure no bubble is present. Allow ample time for the fluorescein and tears to settle. Excessive tearing, epiphora, and blepharospasm will compromise proper fluorescein pattern and evaluation. Observe behind slit lamp with cobalt blue filter and yellow rattan filter attached. Then evaluate the zones and overall diameter. Using the eyelids, manipulate the lens to a central position for best assessment of overall diameter. Monitor the overall sagittal fit of the lens. Is it too steep or too flat? Observe individual zones for fine-tuning if necessary. Finally, record and begin orthokeratology treatment. If possible, photograph the fluorescein pattern. Perform over-refraction. Provide insertion and removal training. Provide care and maintenance instructions, and schedule next day visit. Follow-up schedule. On day 1, ask for the time of insertion and removal. Perform topography, visual acuity, over-refraction, and slit lamp exam. Request that the patient bring their lenses and insert themselves to confirm competency. In subsequent visits, check history, quality of life, vision, halos and glare, if noticeable regression occurs, at what time, and comfort. Unaided visual acuity, monocular and binocular. Slit lamp exam, corneal staining, tear breakup time, inflammation, and injection. Check for allergies and papillary conjunctivitis. Topography, tangential difference maps, refraction, manifest and over-refraction. Lenses, evaluate lens condition and lens care regimen. Shown are some possible fluorescein patterns post-treatment. Flat AC2. Excessive fluorescein can be seen in the peripheral alignment zone region. The contact lens will be flat and may decenter superiorly. Simply adjust by targeting the AC2 in the Orthotool software and steepen the curve, or make the value smaller. Reverse curve. With an overly steep reverse curve, bubbles may appear in the reverse zone with possible fluorescein seen in the center, indicating excessive apical clearance. Adjust by flattening the reverse curve or make the value higher, or widening the reverse curve width. Apical touch. When there is central staining, there may be insufficient apical clearance. Correct by steepening the reverse curve or alignment curve by making the values lower. Excessive apical clearance. Significant fluorescein can be seen centrally. Adjust by flattening the reverse curve or alignment curve by making the value larger.